Okay, to set up for a VD or frog leg position or view, you're going to place the patient on a V with the cassette underneath, or if it's a bigger patient, you'll place the cassette on this trolley. You're going to use a sandbag over the chest, and the legs are going to be positioned relaxed out to the side. And they're going to be relaxed. You can use sandbags to hold them in place. Then you're going to center the patient and change the borders, collimation borders, to view the hip area. You're doing a view of the hips, and then you will then measure the thickness from the patient's hips to the cassette. Sorry, get the right. Which here is about 11 centimeters. You will then check the grid measurements here. So thickness 11 centimeters, your KVs will be 62. Abdomen 68, and the MAs will be 5. And then you will adjust these to 5 and 68. And then you will take the x-ray. Don't forget to label the cassette either right or left side. So this can be seen on the x-ray.
I'm not taking a laptop if I said we were, because it's such an old system. No, in my room. It's an old system. It's not letting me go with the things. And so I'm going to have to one of those. I'm going to convert. It's the same pattern. Old school straight on. But the other thing I think we should do is put little widgets on it, right? So, at the top. Are we near it? Ready? Not there. And also, bubble wrap, just on the pads, but you've got to do your ties around it. I might have some comfort. Just clip around there too. No, that's good.
Yeah, we've got down there.
I know we've got material, just as important. Okay, we've got sugar. Ready? Size.
We've got between 5 and 6.5.
I'm going to that one. I know. Sorry. Yes. Take that please. Too big. That's too big. That's silly. Who's tying those? Who's leaving those? That's pathetic. It needs to be long enough. That's leaving the road back there. I was going to right, the road on.
In the clinic I work at, we do not develop our own film. We package it up and send it off to our local hospital for developing. This is due to not having a darkroom or a digital x-ray machine that would provide a digital copy of the x-ray. Although this is the case, the process of developing a film is you're going to prepare 3 buckets in the darkroom, one with a fixer, one with water, and one with developer. The order in which you want to position these buckets is developer first, water in the middle, fixer last, as this is the order in which you will develop the x-ray film. Then you're going to prepare a string line to hang your film on. This is so it can drip dry. You're going to remove the x-ray film from the cassette. This is all done within the darkroom, as well as all the following steps. You're using clips, hold the film at edges, dip it into the developer and leave for about 3 to 5 minutes. Then you're going to quickly transfer the film from the developer solution into the water tank, only rinsing for about 10 seconds. Lastly, you'll transfer it into the fixer tank for about 30 seconds. Hang the film to drip dye. The darkroom light can now be turned on and the film viewed once the cloudy/milky appearance disappears or has cleared. Following fixing, the film should be thoroughly washed and dried. Preparation for film development includes checking developer and fixer levels and making sure that they're an adequate temperature. Ensure your hands are clean and dry. Select the suitable hangers and lock the door of the darkroom and turn on the safe light and turn off the main light. To unload the cassette, you're going to open the cassette and take hold of the film gently by one corner with your thumb and forefinger, making sure you do not damage the screen. You're going to remove the film and close the cassette to prevent dirt from falling into it. Okay, to prepare contrast media can either be injected or administered orally. You are going to want to check the individual contrast media for dosage rate and route of administration, as this will vary between products and the patient, as well as route of administration, etc. Oral administration can be done by adding the contrast media to the patient's food or administering directly into their mouth using a syringe. Injectables can be given intravenously, intramuscularly, or subcutaneously, depending on the product type. For contrast media being administered orally, the patient should be fasted. Equipment necessary may include needles, depending on the route of administration, syringes, and your contrast media of choice. There are many different film faults that can occur when producing an X-ray. Each fault is resolved in a different manner. Examples of film faults and how to solve them include the film may be too dark. This is caused by overexposure, underdevelopment, the FFD being too short, or fogging. To resolve these issues, you will either reduce exposure factors and check your technique chart against the patient and X-ray view. Check the developer temperature. Make sure the development time is precise. Increase FFD. Collimate the beam. Change storage, and check film expiry date, etc. Film can also be too pale, which is caused by underexposure, which is resolved by increasing the exposure factors. Extraneous marks can be caused by dirty screens, developer or fixer splashes, etc., which is solved by cleaning screens or taking care during the development process. And then there's chemical stains caused by insufficient fixing or washing, which can be solved by taking extra care during these processes and being thorough. There are a number of hazards associated with taking an X-ray and radiography exposure. It is important that you take precautions to protect yourself against against exposure when taking an X-ray. This includes wearing appropriate PPE, like your lead apron, thyroid protector, lead gloves, etc. Understanding control areas. So your control area is 2 meters, anywhere from 2 meters away from the X-ray machine, and making use of warning signs. Lastly, to take an X-ray, you're going to turn on the X-ray machine and allow it to warm up. Position the patient. Then you're going to check focal film distance, collimate beams, measure thickness, and adjust MAs and KVs in accordance to the clinic technique chart. You're going to then enter the control area, so stand 2 meters from the X-ray machine or further. turn on the X-ray in progress sign, call out X-ray to warn others nearby. And then if you're taking an abdominal X-ray, you're going to take the X-ray as the patient inhales. So as the patient inhales, you'll press down on the controller button and take the X-ray. If it is hard or you can't take the X-ray on inhalation, you can do it on exhalation. Just need to make sure that you take note of this on the X-ray and on the clinic's patient's file. And for non-abdominal X-rays, just press down on the button and take the X-ray whenever the patient is ready.